My name is Dr. Seema Nanda. I'm in Houston, Texas, and I practice with a corneal specialist where I teach students as well who rotate through our office. Fourth-year students who come and learn about the cornea and anything that we can treat anterior segment. For my patients, a lot of the times they come into my practice and they've gone to several other practices and they don't know what to do because they've had a recurrent erosion that's not going away. They've had other things in the cornea that they don't know what else to do, and maybe a central scar that they think, oh, the only thing I can do now is a transplant. And when I tell them, hey, there's a new product, and it's not even that new, but there's a new idea, again, a new hope, that maybe if we can remove that tissue without having a transplant, put a regenerative membrane on, and they don't have scarring, and then they can see again, it's amazing. Since I work with a corneal specialist, we have so many patients who have the need for a corneal transplant. But if we can reduce that, because once you have a corneal transplant, you're babysitting that cornea for 5 years. Did you know that? 5 years, they get reject. If we don't have to do that anymore, and then we don't have to worry about insurance, if they're gonna cover the transplant or they're not, we've got this unmet need. We can now fix it. I think it's great. So I've been using ProCare for almost a decade now and has made a revolutionary change in my practice. We started using it on train wrecks only. We had a guy come in with an acid burn. His cornea was all gone. He had nothing left. We saw maybe a few limbal stem cells and I thought, is this gonna work or not? It took me several ProCares and in about 3 weeks, we regenerated his cornea. He was count fingers and it dropped him to 20/30. And I thought, there's no way he's gonna see again. We've lost this eye. It's gonna become tisicle shrunk and everything. And they're like, oh my gosh, this is so great. So I've been doing this about a decade. And I thought that was the first case. And then I did it on a patient with map-dot fingerprint or ABMD. And when we cleared up her cornea, just to make sure she sees better, because we were trying to optimize the ocular surface after her cataract surgery, which we thought went well, and it didn't. And then we realized, oh, okay, why don't we try this? And we cleaned it up. But she was also on many different artificial tears, prescriptive medicines for regenerating her tear function, and that wasn't helping her. And then when we did this to clean up her surface, and then we took the membrane off, she says, I don't have a problem anymore. My vision's clear, and I don't need my prescriptive eye drops anymore. I'm like, what do you mean? I don't need the Restasis. I don't need it. Why? Because you fixed my dry eye. I go, I didn't fix anything. What's going on here? Then I realized it's doing something else. It's regenerating those corneal nerves. So then I started doing on more and more and more different types of patients. So it started with an alkali or acid burn. It progressed to ABMD type patients, then to severe keratitis, then recurrent erosions. It's just been a progressive change in my practice. I don't even think not to do it anymore. It's just been so revolutionary. So the biggest difference that I've seen between cryopreserved and dehydrated is that one is anti-inflammatory and one is pro-inflammatory. So when I put a dehydrated membrane, and I've done several of them, I put a dehydrated membrane on the cornea, a couple of things happen. One, the membrane slips from under the contact lens. I said, where'd it go? The patient will call me in the evening going, it was blurry when I was in your office and now I can see totally clearly. I have them come back the next day, the membrane's gone. So they just wasted all this money, time, energy, just to put the membrane on for it to slip again. You try to do it again, it happens again. And if it does stay put, guess what happens? It sticks onto the corneal surface so hard that it dissolves into the corneal surface, doesn't go away, and when you take the contact lens off, all of a sudden it leaves a footprint in the sand. You put the footprint on, you're like, where's the membrane? It's gone, but now the cornea is all mucked up. Anyway, the cornea is not a smooth surface anymore. It was more destroyed after I treated with the dehydrated amnion. So that damn lens didn't do anything for me. I have treated so many patients now and have done over 1,000 ProCare to this date, and I'm still blown away by that number. Over and over again, patients come in, want to be treated. They don't know that this technology is out there. I come and I show that to them. And even then, doing so many of these patients, changing their lives, changes my life too. And the one big wow moment that I've seen was a patient who was a cake artist, and she designed cakes for a living, wedding cakes, birthdays, everything. People come to her and say, make me a cake that looks like a transformer, and she does it. And it's amazing. And just like that transformer, she's transformed me, because I look at these patients over and over again. I'm like, I did that? No, everybody can do that. We can all be part of this amazing family. So what happened was she comes to me and says, I've been to 3 different corneal specialists over the last 9 months, and I've been really in a lot of pain because I was designing a cake and I was changing out the blade of an X-Acto knife, and as I was doing it, I pushed too hard and it ripped my cornea. And when it did so, it didn't close back correctly. So I went to one corneal specialist, then another, and then I saw, and I was researching all over the internet, and then I saw a blog article that you wrote, and I've been searching all over for you, and I want to know, is this you? And she hands me your iPhone. I looked and I'm like, yeah, it's not on America's Most Wanted. Okay, it's me. So I said, well, I don't know if I can fix you, but I'm going to try. So I cleaned up the cornea. I put the membrane on. I saw her back in a few days. I saw that the membrane was dissolved, and I put another one on. It cleaned it up. I saw her back in a week. I saw her back in a month, and now it's been a year. And she's still doing fine. And she suffered for 9 months. And I figured, okay, anybody suffering for 9 months better have a baby coming out of them. She said she agreed. She didn't have a baby. She just had this big old erosion. So now it's been a year later, and she's so happy and so thankful that wow moment came for me when she designed a cake shaped as a heart. She put little glasses on it and a fondant Band-Aid saying, thanks for fixing my boo-boo. I thought, wow, this is so great. Just that one person, I've changed that life, and now multiply by 1,000. And now that I'm sharing this story for you, I hope you have as many wow moments as I had. It just blows my mind.